Hey everybody, Dennis Stanley here with Respiratory Sensei, and today I'm excited to talk to you about something called ROX. No, not that kind of ROX. This is ROX, R-O-X. It's a special respiratory calculation that helps you determine how effective you're being when you have a patient on a high-flow nasal cannula and preventing intubation and mechanical ventilatory support. Now, I know what you're thinking. Great, we're going to learn another nerdy respiratory calculation. But hang on. If you learn this one, you're going to look like a genius to the doctors and the healthcare staff. And that's important, to look like a genius. Well, it's also important to keep somebody off the ventilator. So, well, maybe that's the more important reason. But anyway, let's learn it. So as the Japanese would say, 𝗕𝗿𝗄𝗃𝗄𝗰𝗄𝗃. Let's do it. All right, the first thing we need to understand is the purpose and the use of a high-flow nasal cannula, because remember, ROX is going to help us to determine if we're being effective with that therapy. Well, the high-flow nasal cannula is a very effective therapy at a certain point on the continuum of care of our patient, particularly as they start declining from a respiratory point of view. Think about this just for a moment. If somebody just starts to decline a little bit, they may need just a little bit of supplemental oxygen, so they may just end up on a nasal cannula or a mask or something. But if they progress with that kind of respiratory problem, they could go all the way to needing to be put on a mechanical ventilator. The question is, how do we keep them from progressing from here to there? And that's where a high-flow nasal cannula can enter in. The high-flow nasal cannula somewhat occupies the space of, say, a non-invasive ventilator. We know we can use those to keep somebody from going on a ventilator. It's got its own little special purposes and is advantageous in many ways. So we can use a high-flow nasal cannula to keep people from regressing, but if we're going to use it, we need something to tell us, is it working? Is it being effective? One thing that we wouldn't want to do is go for hours thinking that everything is going okay, only to have the patient code on us and end up on a ventilator. No, we're going to want to know if the high-flow nasal cannula is not really working as well as we think it is. Maybe we want to stop and just go to that ventilator right away. And so we want something to be able to help us to assess that. And to be honest with you, it can be quite confusing. So let's just say, for example, you have somebody on a high-flow nasal cannula and I come around the corner and I say, hey, how's your patient doing? And you say, they're doing great. They're sitting at 95%. I say, that sounds really good. And you think you're doing well at preventing them from going to a ventilator. But just telling me that they're 95% isn't the whole story, is it? What if you also said that's on an FiO2 of 100% and their respiratory rate is 44? Now I'm thinking, wait a minute, that may be a 95% sat, but you're having to do an awful lot to get that sat. And that doesn't sound like it's going very well. I'm going to be thinking your patient's going to end up on that ventilator anyway. And so this is what ROX is about. It is a calculation that incorporates a few other parameters that will help us more effectively decide, is this going well on this high-flow nasal cannula or is it not going well? So what is ROX? No, remember I said it's not that thing. It's ROX, which stands for Respiratory Oxygen Index. And that's because it involves just three simple numbers, two of which relate to the oxygenation status of the patient, and one relates to the respiratory, specifically the respiratory rate. All right, so here's the formula right here. Let's take a look at that. It is the SpO2 divided by the FiO2 divided by the respiratory rate. It's a pretty simple formula. In fact, it's a divide and then another divide. The only thing you need to memorize here is the order at which you need to do it. And it's SpO2 divided by FiO2 divided by respiratory rate, which is SFR. Doesn't the ROX formula just so freaking rocks? So freaking rocks, right? SFR. All right, so that's the formula. Let's check it out. One thing I'll also tell you is that the number is called an index. Now, this is somewhat nerdy, and you don't really need to know this, but we call a number an index when we want to ignore all of the units of measure. And so we're not looking at any units of measure. The ROX is just a number that floats out there, and it has a specific meaning, but there are no units to it. That's why it's called an index. All right, taking a look at a first patient here, we have a patient who's sitting at 95%, and their FiO2 is 0.6, the respiratory rate is 24. One thing that we have to remember is that we very loosely talk about oxygen percentage. If I looked at an FiO2 of 0.6, you might use the word 60%, or you might even see that in the question. But remember, for this formula to work out properly, you need to use the FiO2 version, which means it needs to be the decimal of 60%. So don't be misguided on that one. Now, when we plug this into the formula, we get 6.597. And that's our ROX. That's our ROX value. That's it. 6.597. Well, so what? What does that mean? What do we do with that? Right, and that's the trick. We do need to understand what the values mean. To understand the meaning of the ROX equation, and particularly the value that you get after equating it, you need to kind of look at a couple of numbers. And the first number you'll need to burn into your brain is 4.88. I know that's kind of a weird number to try to memorize, but if your ROX is above 4.88, then generally we're going to say you're doing pretty good. In other words, you're being fairly successful at preventing the patient from progressing, and we mean progressing to ultimately needing a ventilator. But if that number starts to go down, then the patient isn't doing as well on the high-flow nasal cannula, and it's a way of understanding also not how well they're doing, but also how well they're trending up or down. So 4.88 looks pretty good, and you're above that, and then you start going below that. It doesn't mean the patient's about to code right now, but it does mean that they're getting worse and worse. Now, the question we have to really ask is, how low do they need to go before we start thinking, you know what, this high-flow nasal cannula thing's not working too well? In other words, at some point, they're probably going to go on a ventilator anyway. And this is important. These numbers are predictive of the future. So just because you have a fairly low number, and we'll talk about those numbers in just a minute, doesn't mean that the patient's in dire straits right now, but it does look forward and try to estimate for you their likelihood of not really making it by going on a ventilator. In other words, they may need a ventilator in the long run. That's what ROX is really calculating. Now, to understand what's considered failure, it also depends upon one other thing that I haven't talked about yet, and that is how long have they been on a high-flow nasal cannula. ROX likes to look at 2, 6, and 12-hour increments. And so for us to understand those numbers, we have to look at a small table, and therefore we have to put on our nerdy glasses so that we can understand that data. So put on your nerdy glasses, and let's take a peek. All right, the key here is to look at some numbers and look and understand how it relates to how long they've been on the high-flow nasal cannula. And at each level, it's a different number that defines failure. But do remember, we are defining failure. Remember, the 4.88 was a high number that if they're above that, that's definitely being successful for you. There's kind of a middle ground in there, depending on how long they've been on, to define failure. And so we'll look at these numbers. Now, I'm going to show you these numbers, and you don't have to memorize these. You can always just Google them anytime you want to. In fact, I never have them memorized. I always have to look them up, it seems like. But I'll look at them now. And so if they have a ROX of 2 hours and it's below 2.85 on a high-flow nasal cannula, if it's below 2.85, then that's predictive after 2 hours that they're probably going to end up on a ventilator and that the high-flow nasal cannula is not being effective. This is important because you could make a decision right now. You could push it a little bit longer if there's something you think you can mitigate, their breathing, an infection, whatever that may be. But you could also decide to come off the high-flow nasal cannula and use a higher level of intervention, something like BiPAP, non-invasive ventilation, or you might just think, I probably just need to go to a ventilator. And so that's the purpose here. Now, if they've been on for 6 hours, then the number is going to be 3.47 that you're paying attention to. And if they've been on for 12 hours, then you don't want a ROX under 3.85. Remember, we're saying if it's under these values, then that predicts a high chance that they're ultimately going to need mechanical ventilation. You may ask how high? Well, that's an interesting question. That's a little bit nerdy too. But somewhere between 69 and 75% chance of needing mechanical ventilatory support in the long run if their numbers are below those that we've listed. And so that's ROX. But now that we understand how to interpret the values in ROX, let's take a look at another patient. So here we have a patient who's sitting at 92% That's not too bad if we just look at the saturation. It's not great, but it's not bad. There's a lot of COPD patients that we'd be very happy with if they were at 92%. But now let's take a look at the cost. Let's take a look at the other two parameters that are required to keep them there. This patient is on 100% oxygen and has a respiratory rate of 34. Those are both fairly significant values. So when we plug those in, we get a ROX of 794 to be exact. Well, that's not very good. In fact, that's below our threshold. So what are we saying there? We're saying that even though for now the patient looks okay at 92%, we're able to predict the future. We're saying this patient's not likely going to continue sustaining this just on a high flow nasal cannula, which is what ROX is really all about, and that the patient has a 69 to 70% chance of ending up on a ventilator. That's because the number 2.794 is below the bottom threshold. Remember, we like to see it above 4.88. If it's above 4.88, we think they're probably doing fine, and it's a predictor that they probably will not need future mechanical ventilation in the current episode. Now, the question is, though, what do we think if it's in between 4.88 and 2.79, or the lower threshold of 2.85? Well, that just means that they're probably going to need something more than a high-flow nasal cannula. They may need non-invasive positive pressure ventilation, or they may ultimately advance to a ventilator, but that's what to think about the numbers. Now, what I want you to pay a special attention to is that it can be very misleading to a healthcare staff. And so you have a patient in the ER, for instance, and they are seemingly doing good. They're on a high-flow nasal cannula, and they're sitting at 92%, 93%. The problem is if the healthcare worker looks just at that, if the doctor just looks at the SAT, everybody's going to be thinking that the patient is doing okay. But after you do the ROX formula, you might find that they're not doing okay. And this allows you to offer better care to the patient, more preemptive care. In other words, it would be better before they went for a little while and just totally crapped out or coded on you, that you understand that they're going to go to a ventilator anyway. The high-flow nasal cannula is insufficient, and that's when you can offer elective intubation and mechanical ventilatory support before the patient gets in that emergency situation. All right, well, I hope that was helpful to you. That's ROX, and it specifically helps us to decide if the patient is doing okay on a high-flow nasal cannula, especially if we're trying to use it to prevent them from progressing further in a respiratory problem and going on mechanical ventilatory support. That means being intubated, that means being exposed to ventilator-associated pneumonia and all kinds of other problems. But at the same time, we want to know the ROX value so that we understand not to wait 10 hours, 12 hours, and think everything's going great just because their saturation is 95. Remember, the saturation is not the whole story. We have to look at the respiratory rate, we have to look at how much the FiO2 is, and also the saturation that we're getting from that to truly understand if we're doing well. So I hope you enjoyed that. What you should do now is you should go to every patient, especially on a high-flow nasal cannula, and do the ROX formula. And you will look like a genius because you'll be able to talk to doctors, even though everybody thinks it's going great. And everything seems to look great from their point of view. You might be able to tell a doctor or a multidisciplinary care team that even though you have somebody on a high-flow nasal cannula, they're not headed towards home. They're probably headed for a ventilator because you understand those numbers. I'm Dennis with Respiratory Sensei. I hope this was helpful. Please like and subscribe. Comment if you've tried the ROX before and it looks like it's pretty cool, or if you'd like to try it, if you're going to try it, let me know. We'd like to hear the result of that. We'll see you later.